We made it. 2023, we're calling it to order. To conduct this meeting wholly electronically and to effectuate both the emergency procedures authorized by FOIA, the CPMT needs to make certain findings and determinations. For the record, I ask for your patience as we go through this. First, because each member of the CPMT is participating in this meeting from a separate location, we must verify that a quorum of members is participating, that each member's voice is clear, audible, and in an appropriate volume for all other members. Accordingly, I'm going to conduct a roll call and ask each CPMT member participating in this meeting to state your name and the location from which you are participating. Please state whether you are joining us from home or agency office. I ask that each of you pay close attention to ensure that you can hear each of your colleagues. Following this roll call, we will vote to establish that every member can hear every other member. Roll call. Leslie.
Leslie Abashan here from home.
Dr. Gloria is not here, I do not believe. Stacy Jones Alexander.
Stacy here from home in Annandale.
Hey, Stacy. Michael Axler. Giving Michael Beckett's time to swallow there. Michael Beckett's.
Michael Beckett's here from his office in Fairfax.
Dr. Boyd. All right, Deb Evans.
Deb Evans here from office in Chantilly.
Annie Henderson.
Here at home in Lawton.
Joe Clemmer.
I'm here at home in Fairfax.
Rick likewise is absent. Dana Jones.
Dana here from home.
Rebecca Sharp. Dawn Schaefer.
I'm here. I'm in the office.
Matt Thompson.
I'm here in the office at the courthouse.
And I don't believe Daryl Washington is here either today. At this point, I will pass the virtual gavel to the acting vice chairman, Michael Beckett, so I may be heard to make the requisite motion. I move that each member's voice may be adequately heard by each other member of the CPMT.
Please state your name to second the motion.
Second it, Leslie Abashan. Sorry.
Thank you, Leslie. All those in agreement say aye, or opposed say aye.
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 Anyone opposed say no. The motion carries.
Second, having established that each member's voice may be heard by every other member, we must next establish the nature of the emergency that compels these emergency procedures, the fact that we are meeting electronically, what type of electronic communication is being used, and how we have arranged for public access to this meeting. Therefore, I move that the state of emergency in effect for Fairfax County caused by the COVID-19 pandemic makes it unsafe and impracticable for the CPMT to physically assemble and unsafe for the public to physically attend any such meeting, and that as such, FOIA's usual procedures, which require the physical assembly of the CPMT and the physical presence of the public, cannot be implemented safely or practically. I further move that the CPMT may conduct this meeting electronically through a dedicated audio conferencing line, and that the public may access the meeting by calling 571-429-5982, conference code 279-261-068, hashtag. It is so moved.
Please state your name to second the motion.
Stacy Alexander, second.
Thank you, Stacy. All those in agreement say aye.
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 If anyone opposes, say no. Hearing none, motion carries.
Finally, it is next required that all the matters addressed today are statutorily required or necessary to continue operations and the discharge of the CPMT's lawful purposes, duties, and responsibilities. It is so moved.
Please state your name to second the motion.
Matt Thompson, second.
Thanks, Matt. All those in agreement say aye.
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 Does anyone oppose? Say no. Hearing none, the motion carries. Now I'll return the gavel to our chair, Chris Leonard, to continue the meeting.
Thank you very much, Dr. Beckett. We'll now begin our agenda items. First, the approval of our December 9th, 2022 meeting minutes. Hopefully folks have had a chance to go through those. You're here, hopefully it says you're here. If you weren't, I hope it says you weren't, et cetera, et cetera. Do I have a motion to approve the minutes?
I so moved.
Motion to approve, Dana Jones.
Got a motion from Dana and a second from Michael. Did I hear that right?
Yes.
All those in favor say aye, please.
Aye.
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 Those opposed say nay. That motion carries. Minutes are approved. All right, let's get into our agenda items. Administrative items. Item A1, Mental Health Initiative State Transportation Costs. We have Jessica Jackson here from the CSB. Jessica?
Hi, everyone. I am here to ask for your review and approval to use MHI, Mental Health Initiative State funding, to use for transportation costs. Just to review a little bit, Mental Health Initiative State funding is used for CSA non-mandated youth. The funding right now is used to fund some staff at the CSB. We currently fund 2 senior clinician positions and 4 case manager positions, as well as an array of services. Those services are all of the typical services that CSA funds, with a few exceptions. Mental Health Initiative state funding cannot fund things like residential, partial hospitalization, and acute setting services, but it does fund in-home services like therapy, mentoring, respite, and other types of therapy. There's not real clear language around the use of the funding for transportation costs. And so I approached the state to ask if we were allowed to use the funding on transportation costs, and they put in place that we just needed to get CPMT approval, as well as some things that we were already doing, like linking the transportation costs to an individual service plan for the youth, and making sure that we were tagging it behind the scenes to this 915 code that we do at the CSB. So we were already doing 2 of those 3 things, but we just needed to get the CPMT approval. I don't anticipate that there would be very many youth that we would authorize the transportation costs for, or that there would be a high cost for the transportation if we did authorize the costs, or if we did authorize the services. So I don't anticipate that this would be a high dollar amount if it were to be authorized. Again, just wanting to make sure that that we reviewed it with you all. We did bring it to CSA management team earlier this week and got their approval, and I'm now just bringing it to you all for your review and approval as well.
Thank you, Jessica. Do we have any questions on the item or any discussion on the item? Seeing and hearing none, I'll entertain a motion to approve.
Matt Thompson, so moved.
Need a second?
Second. Stacy Alexander, second.
Thank you, Stacy. It's been moved and seconded. All those in favor, please say aye.
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 Those opposed, nay. That motion carries. Thank you, Jessica.
Thank you.
Item A2, policy for coverage of credit card service fee. Janet.
Yes, good afternoon. This is a request that I brought to you back in December. We are in the process of setting up a credit card payment process for families who owe their parental contribution for CSA funded services. And presently, our fiscal staff are only allowed to accept a check or a money order. They are not allowed, we don't have the capacity to accept a credit card. Many of our families do request the ability to use a credit card to pay their fees. And some of them have asked for the ability to use their flexible spending account, credit cards and health spending account credit cards. We are in the process of working with DIT and the other folks that are necessary for this, Department of Finance, I believe, to set up this credit card process. We'd like to create a link on our website so that parents can go in and make those payments. One of the questions is, how will the service convenience fee be charged? It is 2.35% of whatever is being charged on the card for each transaction that's charged. And so the choices are that convenience fee would be passed on to the family. If you do it that way, you can't use the flexible spending account because they don't allow anything that's not medical to be covered. Other programs similar to CSA, like the Health Department and the Community Services Board and the ADAPT program, actually absorb those small fees themselves within their program. So this has been reviewed with our DFS fiscal staff, and the recommendation is that the CPMT would approve a policy that would allow the service fee to be covered by program support funds, which gives families the flexibility of using the credit card and the ability to use their medical spending account, and is consistent with other programs of a similar nature. Please note in this item that there's a chart attached about how much money we typically collect in an average year from parents. And the average for the past 5 years has been over $200,000, $238,000. And even if we were to collect on all those, the cost, would be, $5,600. That's if every person paid with a credit card. So we are asking that this be permitted for the service fee to be absorbed by our program.
Any questions?
Just a comment, that's a really good percentage, and the amount predicted for complete English is a problem today. $5,600 is a drop in the bucket for families being able to use the FSA card, in my opinion.
Thank you, Joe. We do believe that our budget, we would be able to absorb that without difficulty, because that's mostly going to be a maximum amount.
I just want to jump in and say I agree with Joe. I think it makes sense to absorb that that small cost into the program, like the other two programs that you mentioned.
Thank you, Dawn.
I'm on the Joe train as well. I agree completely.
So do I.
Are there any other questions or comments? I'll entertain a motion.
So moved. Leslie.
Thanks,
Second,
Leslie.
Michael Beckett's.
Thank you. All that's been moved and seconded.
Dawn.
All those in favor, please say aye.
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 Those opposed? That motion carries. Thank you. Excellent, Janet. Thank you very much. Moving on down, contract items, out-of-state contract approvals. My favorite, Barbara Martinez.
I mean, Barbara Mandrell's not your favorite?
That's a blast. That's a blast from the past.
You're dating yourself.
That's right.
And me, ha. First of all, I want to apologize. The date on the memo is wrong. There was a quick turnaround from this, and I wasn't on the top of my game the day that I did the memo. So I apologize. Make sure the dates are correct in the future. We did receive one request that was approved by the CSA management team on Monday of this week, Monday the 23rd, and that is for Hazelton Betty Ford in Plymouth, Minnesota, for inpatient substance detox and residential treatment for an adolescent. Other than, and the reason why we needed it, as we've discussed in other meetings, is there aren't any in the state of Virginia. With that, there's an existing 10 out-of-state residential contracts right now that have been previously approved by the CSA management team or this committee. And that's all for today.
Super quick.
Short and
Just for
sweet.
the record, if those are the errors you make, just keep those errors like that. That's. we
Thank
like
you.
to correct the errors.
I prefer no errors, but
Yeah, but if you have to have one.
yes, I
Um,
appreciate it. Thank you.
Does anybody have any questions or comments or discussion? Okay. Seeing none, I think we'll move on to the next agenda item. Thank you, Barbara. We'll move to our information items, our budget report. Desiree.
Hi, everyone. Janet, were you able to switch out the report?
Desiree, this is not the correct memo. Is that? This
No,
is
the
not correct.
memo was fine. It was just the
Okay.
other chart, the bottom half of the other
Okay,
chart. The memo was fine.
Okay, the
Okay.
memo is up on the screen and I will put the correct chart up for them when it's time.
Perfect.
Okay.
Thank you so much. So looking at the actuals for CSA for 2023, we've spent 7.9 million with 682 unique youths. This is in comparison about $411,000 less than this time last year. And that looks like our total youth count is down for most categories. So 5% reduction in cost there. So we were at 8.3 million around this time last year, and this report is through November. There has been some issues just with the state's system and some of the behind the scenes data that we need to do some items. I think they got a new system, so our December data is not quite finalized. So this is the November data, which is final and has been submitted via leaders. So going down to residential treatment, you'll see that we served 6 fewer youth, but our cost is up 38%. And so the average cost per child is trending upwards. And our private day, the cost is down about 17%, which is consistent with the reduction in about 35 youth served. For the non-residential foster care, our costs are up. And I'll need to look into kind of what might be driving that increase in expenditure, because it's probably beyond just the number of youth. It's only 3 additional youth served, but I don't have the underlying factor for that for this meeting. For community services, we are at $505,000 for this program year, so expenses are down about 56%. So the cost per child is trending downwards, and we've also serviced 77 less youth for that cost. And then nothing else really in the non-mandated services. More youth are spending more money, but it's pretty much in parallel. So I've highlighted everything in that piece kind of with the top chart. Can go down to this. Okay, perfect. Sales fee and residential. We have spent $1.3 million to date, and non-residential we spent just under 6.8 million. We've serviced 29 residential youth and 590 non-residential for mandated services. On non-mandated services, our cost is up about 60 grand from this time last year. So we spent 190,000. This time last year, we were at about 130,000. So 62 for community-based and 46 for ICC. At the key indicators at the bottom, I'm kind of reiterating what I captured in like the first chart. You'll notice that our average cost per child for residential is up. So we were servicing less clients, but the cost per child is more expensive. But on the non-residential and community-based services, the cost per child is trending downward, which is driving our average cost per child in the aggregate slightly downward versus last year. So, residential is really just up in all categories, just across the board. And then looking down, we've spent, looking at our SPED wraparound budget, we've spent $57,000 to date. So we have 92% of our budget remaining. Our non-mandated, we've spent 170,000, so we have 90% of our budget remaining, and we've spent 7.9 million for our total 2023 allocation. So 78% remaining, which is consistent. We're about 1 or 2% different in each of those categories than we were this time last year. So relatively consistent. At this time, I'll take any questions you might have. Hopefully none, but.
Staying sort of kind of off the side, tangential question. How are these percentages compared to pre-COVID?
Oh, that's a great question. I do not know that answer off the top of my head. I can, let me look. Actually, I can find it really quick. If you give me just 1 minute, I can.
While
COVID
Desiree's
is 2020,
looking,
right? So anything 2019 would be pre-COVID, right?
Yes.
It's been so long.
so Joe, while Desiree is new to our program, and just what we have noticed is that we are getting fewer youth referred to CSA, and so our overall costs are going down. We're still continuing to see residential referrals because there's not a lot of alternatives for that. But some of the other programs are serving fewer children. So for example, our foster care numbers for a while during the pandemic were low. Our numbers of other children who were getting prevention services from the Department of Family Services were lower. And so just overall, what we're seeing is fewer children referred to us. And then we have noticed fewer children are being served through the IEP. And Kelly Conrita has given some explanations to us around what's going on with that, capacity issues, but also they have a seclusion and restraint policy that prohibits them from using certain programs. So just in general, are what we call voluntary services. So children getting CSB and school social workers is kind of hanging steady, but some of our other programs during COVID had a reduction in youth referrals. We are starting to see more court referrals, and I think just generally things might be picking up a little bit. Kelly just appeared on the screen. If there's any specific questions around IEP, she can address that. It's hard for the budget folks to understand the programmatic trends. They can speak to usually the numbers and how the numbers change, but not really why. That's usually more of a programmatic kind of conversation. And we can address that if you would like us to.
So just like looking high level at like 2018, November of 2018 versus this year, which would be our pre-COVID like baseline. On the residential education side, it looks like our costs are up about 540 grand there. So the education for residential Medicaid placements seems to be what's driving the average cost per child up on the residential. And there, our total client served is still less. If you compare like the residential, the mandated clients pre-COVID, it's about 689. We're at about 619 for this year. So it is about 70 fewer youth for mandated services. The difference is a little bit less jarring for the non-mandated. It was like 143 youth that we were servicing versus 108. So, and just in terms of like aggregate, aggregate numbers, like on the residential side, it seems like it's gotten a lot more expensive for the residential Medicaid placements in general, not necessarily driven by number of youth. The number of youth is actually a little bit consistent, like for the residential Medicaid placements, but the cost has gone up significantly there. The average cost per child is definitely higher this year versus then, which I think we would expect with the cost of just inflation and staff to, service the kids. The cost per child is up largely across the board for most categories versus our pre-COVID timeline. But it looks like aggregate maybe about 100 less youth in the program from mandated and non-mandated services pre-COVID versus now. And hopefully that addresses your high-level concern, but we can certainly, ahead of the next meeting, if you have more specific nuance, we can follow up with programs to kind of dig into.
No, I was just curious from a high level, not necessarily specifics. Although you do a good job of explaining, both of you.
I caught most of that, but he kind of cut out for me.
I was just saying thank you.
Okay, thank you.
It does, right. I think it's a good point. I think maybe we should, maybe for the next year, if we could add that to our report out. I'm doing some work currently around our early childhood efforts, early childhood education efforts. And one of the things we're seeing is the amount of program inventory that we've had pre-COVID is down from what it was pre-COVID. So what we have now available for kids is less because a lot of those programs weren't able to make it through. So I think there's a lot of pre-post for various service areas, especially around kids. So maybe let's kind of do the snapshot of about a year in advance of the 2020 timeframe, and then we can just start to trend line that out as we continue to recover. Maybe we could do that for the next year and include that in our discussions.
Absolutely.
Any other comments or questions for Desiree? Okay, seeing none. Thank you, Desiree. Getting down to I-2, state reporting of administrative costs for the CSA program. Janet, you're back on.
Okay. I wanted to share with you all some reporting that we recently did to the state. They have begun annually requesting from us a report on the administrative costs to run the CSA program locally. And I had to report this to them before I could bring it to you, so I apologize for that. Our analysis included the cost of staff who support CSA, even though their official title is not a CSA program staff. We do actually have a total of 22 full-time staff who work to support CSA and 11 staff whose support of CSA is a portion of their time. The number of staff involved, we have a DFS finance team. We have legal representation. We have Barbara's team with DPMM, Department of Procurement and Materials Management. We have the official CSA program staff, and that includes our UR staff. And then we have 3 staff working with FCPS who do manage billing and generating purchase orders. And so it's a total of, like I said, 22 full-time staff support and 11 people who have a portion of their time devoted. And we also have the costs for our federal reimbursement team, and we included those not as FTEs, but as just overhead costs. And the general fund costs that were reported to the state were $3.2 million to administer the CSA program locally. And that is in comparison to what the state provides in terms of funding for administration. We have an allocation from them of $99,512. The state's portion that they provide to us is $53,623. So there is a bit of a differential between what they offer for support and what Fairfax County must provide to run a program of this magnitude. I have been told that 10% of your budget for overhead and administration is an acceptable range. And so our budget is somewhere in the $35 million annually, and our costs appear to be slightly lower than that. So just sharing that with you all. Happy to answer any questions. And if you don't mind me saying, we are probably the largest, we have the largest budget. I'm sure we are the largest staff support. There are some jurisdictions that really only have one person or a part-time person who's operating their program. They serve a much smaller number of children, their capacity to do this work. The person who's in my role is basically, the cook and the bottle washer and, all the stuff, budget and contracting. And so I feel very fortunate to have the number of people supporting this program the way that we do. And it allows us to function in a very different way than some other folks in the state can.
Okay, Janet, any questions?
I hate to be Mr. Brain Dead today. Is this a good thing? This is good, right? This information?
Do we evaluate it as being a positive or? Yeah, I think that it's helpful for everyone to understand that this may not look like it from the outside, but there's an awful lot of work that goes on. Just the finance team, the number of purchase orders, the number of transactions. I mean, we're spending over $30 million, but sometimes the transactions are, $150 or, small amounts of money, gas cards and transportation and $100, so it's a lot of transactions, and the kind of reporting and the fiscal tracking that goes into this is very extensive. And so it may look, the CSA management team is meeting. I'll just say we're monitoring providers. We're looking at serious incident reports. We're looking what happens to children. The UR staff are looking at all the plans, a lot of paperwork. Every one of these things can be audited by the state. So I would just say it is good for me to be able to share with you all this kind of concrete information about running the program and why it's costly, why these staff are needed. And again, the good thing about it, Joe, is that we would be audited, and if we didn't have the right support, it would be very difficult to meet the expectations. So I feel grateful that we have what we have.
Thanks, Janet.
Anyone else? All right, Janet. Keep moving along to I3, fiscal analysis of private day rate setting methodology.
This is one that we've talked about many times, and I'm going to perhaps call upon my colleague, Kelly Conrita from the school system. Just this morning, we received the state's fiscal analysis for private day rate setting. So if you don't mind, I think we should probably review this in pretty thoroughly and try to understand it. The good news of this is this rate setting methodology was developed, I believe, for a problem that was occurring pre-pandemic. And the analysis and some of the work that was done was trying to address a pre-pandemic problem. I think that we're in a different place now And so it looks as if there are some budget bills that I did include in the packet that suggest that this would not move forward. And when you see the fiscal analysis, you'll probably sort of see why it would be less likely that this would move forward. So I will just sort of give the overview and give you the local fiscal analysis, and then we'll take a look at what the state report is. It literally came in this morning, so I haven't had a chance to thoroughly understand it, nor have our budget staff. I want to thank Tim Elsesser, our DFS budget manager, who did the analysis of the funding. And we had the state had a consultant come in. They, in the end, after evaluating rates, they came up with a tiered system so that there are 9 tiers, one set of tiers for the rest of Virginia, and then a set for Northern Virginia, and a tier for out-of-state programs. They're looking at daily tuition only, so they were trying to regulate and rate set a portion of the costs for private day due to the historical increases in expenditures that were happening pre-pandemic. That's no longer the case, that the expenditures are rising. When we took a look at our data, our determination was that the average daily tuition would increase by 11.47%, or $43 per day, for an average annual cost increase of $9,872 per student, or locally, our portion of that would be $4,500. Interestingly enough, the state in their analysis determined that it would be a 12% cost increase, and I think about $38 more per day. So Tim deserves some real credit for the work that he did. In the table that I'm sharing on the screen, what we did is we looked at what tier the children were at in this current year, and then we applied the proposed rates for FY24 for that tier, and determined that for a current set of 180 youth that we're presently have the data on, it would be $1.7 million more if their tier was held equal and we applied next year's rates to that. We also projected out what would happen if we were serving 200 youth or 220 youth, and it allowed us to just have an understanding of, as more children are served, the costs obviously would then rise. We did it in terms of the total expenditure and then what our portion of that would be. So table 2 is just looking at what our share, which is the 46.11% of the overall cost. Another thing that was uncovered, Tim identified that for the children that were being looked at, 92 of our youth, their costs would increase by $108.52 per day. But for 88 of the youth, what we're paying now is more than what the state's rate would suggest, that rate would decrease by $41.43. That may sound like a good thing, that in the end, this rate setting might work because it would balance itself out. But there's a bit of a problem with that, in that we are not sure how the private days would handle being told that their rates would have to decrease. So they're accustomed to building their budgets around a certain cost per child at the tier, and to have this imposed on them and be told you can no longer charge this, you'll have to charge less. That could be a real difficulty for them. And in fact, what we would notice then is there would be $679,000 less that would be permitted by the state to reimburse those providers based on their current costs and their current structure. One of the things to note about this, and I don't mean to get into too much detail, but we've had this happen before because they did a rate setting one of the years, and they only permitted CSA to pay to a certain amount. And then if the provider charged more than that, someone else had to pay that, and it was our school system. The IEP they are required to administer the IEP. And so if CSA is limited in what we can pay by this tiered system, then someone would have to pay that extra unless the provider just decided to lower their rates. The other thing the provider could do is say, oh, we'll put this child at a higher tier. So we're not thinking that this tier system is a helpful way to address this because there's some unintended consequences. So when we put that together, there would be the children who would cost us more would be 1.7 million. And then there would be this roughly 700,000 that somebody else would have to cover. And so the total then cost to us would be roughly 2.5 million when you look at what CSA would cover, what Fairfax County Schools might have to cover, and what Falls Church would have to cover for those cases. So just to be, and just to go over a few more things, again, we do not think this is going to go forward. We think this will not be approved. But this situation would be such that the rate setting that OCS is doing, they're not equipped for doing rate setting. What they did for FY24 was just do a 10% for all the providers across the tiers. It wasn't related to any service changes or staffing or any specific program improvements. It was just giving everybody a 10%, not tied to, consumer price index or any other index. When we have done our analysis of our private day program expenditures, our annual cost contract rate increases is 2.46%, not 10%. The highest one year was 5.2%. So again, the 10% that the state came up with doesn't really make a lot of sense to us. And as I pointed out, if there's some costs that can't be covered by CSA, that is an impact on the sum sufficiency, which is a key component of CSA. And we are not sure how rate setting would occur in the future. OCS does not have a role in contracting now. How would they do this? We're aware that Maryland does it case by each school. And having kind of across the board blanket cost increases might not actually be the most effective way. And it impacts the local government's ability to do our contracting and our contract rate negotiation. So the state's analysis, I did change the item and just gave you all this information. Their fiscal analysis showed that the daily difference in cost would be the 38.07 cents for an overall 12% cost increase if the rate setting was put into place. That would cost a total of over 20 million for the Commonwealth as a whole, and localities would have an almost $7 million additional cost just based on rate setting. So I will, I think that the budget bill to address this, that removes this requirement, exchanges it and basically says that OCS should instead take a look at those localities that appear to be sending their children to private day at a higher percentage than what the recommended standard is, and offer technical assistance to them. So instead of doing rate setting, they should probably focus on those localities that have a difficulty and offer them technical assistance instead of doing this rate setting. I won't go into it because I think it's a bit much, but I did attach the actual document that was provided, and the chart that I'm showing you right now shows you that the ones on the right are where it would cost more, and the ones in red would be where the tiered rate is lower than what we're currently paying. And this is where you would see the differential that somebody else would have to cover unless the provider said, oh yes, we'll accept the tiered rates. So I will just pause here, and this is a lot of information, and I just wanted to make sure you all had the latest information, both what the fiscal analysis shows, but also that we presently don't believe that this is going forward, and we just have to monitor the legislation very closely.
Questions or discussion for Janet?
Hey, Janice, Leslie, how many hours of meetings did you go to working on this report? Can we put that in the cost too?
I think I'll just say that many of us have spent a lot of time on this. Kelly has spent an enormous amount of time. She had to understand, talk to all these providers. The providers had to identify which tier the children were in. We had to report that to state. We had to actually amend our reporting to begin using this tier system. We've been to a lot of meetings. And I'm probably missing out on the number of hours and the amount of time that people have put into studying this and trying to understand it. And, you know, if you don't mind, I'll just ask Kelly if she had any comment as well. I mean, she really has mastered this and been a key player in trying to understand this.
You're being very gracious, Janet, but I also couldn't have done it without Tim's work and everybody in finance. And there were, you know, a lot related even to our Harmony system and like adding coding. This is definitely a group project, but yes, we are all hoping that it doesn't go forward. If something happens and it does, then we'll figure it out, 'cause that's what we do. So.
All right. Anyone else? Okay. All right. So we'll move on down to item I4, our overview of our children's behavioral health plan. Peter, Laverne, I see you. Peter, I don't see you.
Do you see me now?
I hear you. I hear you now. Oh, now I see you.
Okay, so
Take it away.
you. So now you can hear and see me, which is, I guess, a good thing. And Laverne is also here, but I don't see her. So good afternoon. So close to the last year, Healthy Minds Fairfax is reporting to you on the development of the new Children's Behavioral Health Plan. And this afternoon, we are pleased to show you or talk a little bit about the new Children's Behavioral Health Plan. I know in your packets, you got the full plan. I will also add that we are working on a final report that will talk about the entire process of how we got to where we are today. So I was wondering, Janet, if you can scroll down to our presentation, if that's possible. And as she's doing that, let me just sort of lay out what we're going to be doing today. I'm going to be talking to you a little bit about what's in the plan, and then Laverne is going to be talking about some of the actions that we've already started in terms of meeting the goals, objectives, and action steps in the plan. We were very happy to get this plan endorsed and approved by the SCIP, the Successful Children's and Youth Policy Team, a couple of weeks ago. And then our Darrell Washington will be presenting the plan to the Board of Supervisors on February 28th. If you can scroll down, please. Thanks. So before we talk about the present and the future, I always think it's important to put everything in context and talk a little bit about the past. And when we talk about the past in Children's Behavioral Health Services in Fairfax County, we are talking about the original blueprint, which I guess what the dates on it was from 2016 through 2022. This blueprint really laid out the foundation and the groundwork that went into building up the behavioral health system that's in place today. And I'm just going to briefly just sort of highlight some of those projects and initiatives that came about because of the original blueprint. all these initiatives are going to continue. We're just hopefully we'll see them grow over the next few years. And we've also talked about these initiatives at prior CPMT meetings. I think one of the biggest achievements in the original blueprint is that we've added not only youth voice to the behavioral health system, but we've increased caregiver voice. And that was done through the Youth Advisory Council and also the Family Advisory Board we now have. And we also increased the members of caregivers on the CPMT. One of the greatest successes actually is the creation of the Fairfax Consortium for Evidence-Based Practices, which is a really nice partnership between Fairfax County and George Mason University, where we've been able to increase evidence-based practices and trainings to clinicians who provide services to Fairfax youth and children. We now have a family peer support partners program who are caregivers who are trained to provide support and guidance to other caregivers. We have the short-term behavioral health services, which is a free counseling services for the eligible youth. And then the last one that I'm going to mention is the Transitional Age Youth Case Management Service. And this is for young people who need additional support as they transition from children's behavioral health into the adult world. So that's just really a snippet of those achievements that we made with the new blueprint. So today we're really going to introduce you to the new Children's Behavioral Health Plan. A lot of the initiatives or the goals and objectives and action steps in this plan is a continuation of that work and also to create new programs and services. A couple of months ago, I talked to you or presented our community input phase, and I talked about the four themes that emerged during that part of this development. Those four themes have now become what we call our four key areas. Having four key areas does allow us to organize the plan. It also allows us to report on the plan, but also will change our language a little bit because as Laverne and I have been talking to the community about this plan, is that we've been talking about how we can put different services and initiatives in each key area. It's important to note that equity is infused throughout the plan from our vision, from our mission, from the values, and in each key area. The plan does build upon the county's One Fairfax policy and focuses on reducing existing disparities in access of care and behavioral health outcomes. In the appendix section of this plan, you will see all of the equity initiatives that have taken place in Fairfax County over the course of years, and we're going to continue that work and, as I mentioned, build upon that work. So let me just sort of talk briefly. If you can just go back, I just want to stay on that screen for one more minute. Thanks. We'll let you know when to move on. You're doing a good job, Janet, talking and moving things around. So thumbs up to you. So let me just sort of talk briefly about each key area. And I'll start with prevention and education. And as we all know that everything we do really does start here because we want to continue to work on helping people become aware of youth behavioral health issues. And when I talk about behavioral health, I'm not just talking about mental health, I'm talking about substance use disorders as well. We also want to reduce the stigma of seeking treatment because as we know, there is a lot of stigma attached to mental health. And when we've been talking to youth, especially with the youth and peer pressure. So we want to focus on that. And the whole reason for that is if people are more aware and we reduce stigma, more people will seek treatment. A key takeaway from our youth survey, and it's a key takeaway almost every time we do the youth survey, is the need for youth to have more protective factors. As we've seen in the youth survey, the more protective factors a youth has, the better they're going to be, the healthier they're going to be. So part of this plan in prevention and education is to really teach adults and caregivers how they can be those protective factors. Also, part of the work in this area is to help our LGBTQ youth feel more accepted and also to bring them more hope. Under access to services, so another key area, the first thing we're going to do is begin to look at the urgent needs of the youth entering the mental health system. And then we're also going to increase resources for those who have a substance use disorder. In this area, we're going to continue our work on increasing services to the underserved and vulnerable populations. We're going to continue to focus on evidence-based practices, and this not only includes additional trainings, but also additional trainings for caregivers to teach caregivers how they can match the evidence-based practice to the needs of their child. We'll continue to support our family peer support program, which we have in place, to see if there's other ways we can utilize it, and at the same time look at models to bring peer support programs for youth, because one of the things we've heard from the youth is that they want to learn and be treated by people who are similar to them. Looking at the navigation of services key area, and this was a constant theme that we heard about in every focus group and every survey, is that our behavioral health system is complex to navigate and people need help. A lot of families were taught about going through any door. What we want to help is create this one door that families can go through. So really for the next year, my focus is going to be on creating this navigation service. We put in a budget request for FY24 and 25 to come up with a navigation system. And so there'll be more talk about that once we get the funding and once we have more plans in place. And then the last key area that I'll talk about is system level changes. And this is really on two things. How do we continue to infuse equity in our behavioral health system? And also how do we continue to focus on trauma-informed practices? In terms of equity, we know one of the better things we need to do is to collect data, our better data on people, on who's receiving behavioral health services and where the people and where do they get the services and where do they live. Part of this, we also be talking to health and human services agencies and private providers on how we can better share this data, because we all collect a lot of data and we keep it in-house, but we have to think of a system how we're sharing this data. We also know that we need to increase who's at the table, so look at our stakeholders and make sure that our stakeholders do represent the cultural and ethnic backgrounds of Fairfax County. And this includes having members of the LGBTQ+ community at the table. We also need to look at the language we use in terms of talking about behavioral health, to move to more affirming and inclusive language. And then finally, as I mentioned about trauma informed, is that we need to continue to support a workforce to support our workforce who are working with kids who have somehow been affected with trauma, and also to promote trauma-informed policies and continue to train people on how to work with those kids who have been traumatized. So that sort of gives you lays out the foundation of the plan. And as I mentioned, we only got the final endorsement from the SCIP, I guess around January 11th, if I have that date in mind, and Laverne will correct me. But Laverne's now going to talk about all the things that we have that we put in action already. So just sort of think about this in the last couple of weeks that we've been busy doing things. And so I'll turn things over to you, Laverne, and Jen, if you can go to the next slide.
Thank you, Peter. As Peter said, since SCIP approved the plan, we got to work. So due to the rise in mental health and substance use concerns amongst youth, the identified gaps in youth services, and many providers feeling overwhelmed, collaborations are being formed to strategize innovative ways to really meet the needs of our youth. To address the prevention and education portion, the CSB's Wellness, Health, and Promotion and Youth and Family programs are working throughout our continuum to ensure all staff are trained in Narcan and Revive and Narcan distribution. Both trainings are not only provided to our staff, but they're also provided to our clients and their families, making Narcan available to all youth and their families that enter a CSB site. Okay. In addition, wellness and youth and family are also in discussion about working across systems to broaden ongoing public service campaigns that affirm language and that also promote how to start the conversation about underage drinking and substance use prevention and use overall, how parents and caregivers can start that conversation. The language in these campaigns are also inclusive, and the work will also allow systems to communicate a unified message about wellness, mental health, and substance use amongst our youth. In concert with emergency services, wellness, health, and promotion, the CSB also facilitates two groups right now. It's the Heads Up, Talk It Out, which is facilitated weekly. And these groups are for youth and their caregivers. Heads Up is for youth who are working on emotional, mental health, and substance use challenges. And Talk It Out is for Talk It Out is for the caregivers of the youth, and it focuses on support and resources for those caregivers. And we invite any and all into these groups. These groups are for individuals who are at all levels, whether you're trying to prevent going deeper into going into a system, or whether you're trying to find out what resources are available. These groups are held every Thursday, and we've had a really robust number of people who are coming out to these groups. We've had as many as 9 parents for months now, 9 families just coming out trying to find out where our resources are, and we've got a really active youth population as well. So, okay. Now, in terms of the lack of access and gap in youth and the gap in youth residential and detoxification services for opioid using youth, that has resulted in the Children's Services Act and the CSB researching appropriate treatment providers, contracting with those treatment providers, and Northern Virginia Family Services was also contracted for the outreach and engagement of young people who experience non-fatal overdoses. I have to say that DPMM was also a large part of helping us to complete this work. We also have started creating a resource map. That resource map basically is designed by levels of care, so that all of the resources and treatment providers that we have found throughout the community, that's CSA, DPMM, and CSB, we place those on a level of care so that we can help begin some of the navigation process. And we share that information within our community with our stakeholders and anyone. We share this map with anyone who are looking for information regarding treatment resources for their youth. CSB is also partnering with additional MAT medication-assisted treatment providers within our community, and we're also resurrecting an intensive outpatient program. We're in the planning process for that IOP program. The number of non-fatal overdoses has increased. And that we're happy to say that the partnership between the Opioid Task Force, public safety officers, and the CSB has contributed to this increase. We're also in the process of recruiting for youth peer support. Janet, we can go to the next slide. Thank you. As Peter stated previously, one of the constant things we heard during the community input phase was that navigating the children's behavioral health system is complex, time-consuming, and stressful. So a work group is forming that will consist of county and public school employees, caregivers, youth, and community members to begin work on this initiative. In kind, the CSB and CSA have also invited members of the opioid task force who work with youth to work with youth and coordination of this effort. In kind, we're also working with our partners. We will continue mapping services as discussed in the previous slide, and this work will also help the service navigators who will assist caregivers and youth in getting connected to services that will meet our youth needs. The first step in working with members of the Healthy Mind Fairfax Collaborative on data sharing is to survey what services are available to children and youth, where the services are located, the criteria for admission, how the services are paid for. Doing so will help inform not only the Healthy Minds Fairfax Collaborative, but our community and where the needs truly lie. In terms of our system level of changes so far, we've been able to expand substance use disorder treatment providers and add them to our developing map. And we have also expedited access to CSA-funded substance use disorder treatment services. So that's just a taste of some of the things that we've been able to do since services began. Janet, next slide, please. Now that the plan is written, the next step is to continue implementation. The plan is for us to have a group of champions. The plan is for us to have a group of champions for each key area. The champions consist of caregivers, youth, representatives from the county's Health and Human Services and Fairfax County Public Schools, as well as the private sector and from family-run organizations. Healthy Minds Fairfax staff is reaching out to our community members to ensure the group of champions consists of people from many cultural and ethnic backgrounds, and that it will represent the community well. Our champions will also be responsible for developing and implementing each area, as well as how each goal and how the goals and objectives will be measured. And next slide, please, Janet. Okay. Just before I take questions, I would also like to say the Fairfax team will be making quarterly reports to the members of SCIPT, and how successful the plan will be reviewed on a quarterly basis, and changes will be made as needed. Any questions? Thank you.
Thank you, Laverne, and thank you, Peter. No further questions. I think this is obviously extraordinarily important. And our chairman, Chairman McKay, has put this right in the bullseye with regards to the board's focus and priorities to address this. So you'll be hearing a lot more of this moving forward. And I think our next stop is February 28th at the board's Health and Human Services Committee, where that will be a committee of the whole. So all the board members will hear this presentation. And in addition to a number of other items, to be able to keep them informed of how we're addressing these issues with our youth in the community. So, anyone else? Well, Joe, I think you may be right. I think there's a little bit of a Happy New Year fog rolling over people. So, thank you. And again, thank you, Laverne and Peter, for all the work that's come and all the work that you're going to be doing moving forward. So thank you. All right, let's go down on our agenda to the Novico private provider items. Do we have any?
Hi there. We just had a Novico meeting not long ago, and the main thing that came out of it was our concern about finding qualified employees and how desperate everyone is and how it's affecting our programs and not in a good way. So that's our biggest concern right now.
Well, you got that right. I mean, that is never seen anything like it. Never seen anything like it. It's just
I haven't.
Hmm.
It's no one has, I think, and it's really frightening in a way.
Yeah.
Because all of our programs, everybody here runs by people, and there's no getting around that.
Right.
So.
I think that's one of the things that we're probably geared up for with our budget. Our budget gets released in 3 or 4 weeks, and this budget is going to be classified as a recruitment retention budget. I mean, it does no good to add new programs because you can't staff what you have. So,
exactly.
It's very frustrating. So hang in. I tell everybody this, hang in there. I don't know if that helps at all, but I just say hang in there.
We will get through this, I hope, but this one is, from the 30 years I've been doing this one is scary to me. So.
Yeah. Okay, our parent reps. Do our parent reps have anything?
Nope, we're here.
Give me a moment.
No.
Okay. All right. Thank you. The cities. Let's start with Falls Church because Leslie always gets to be first. So let's start with Falls Church.
Morning, everybody. I don't really have anything to report today, but thank you, everybody, for all the hard work.
Sure you don't want to eat into some of Leslie's time? We'll give you some of Leslie's time.
Normally, I'm the one talking, so I cede my time to Leslie.
Oh, I wish you wouldn't have said that. Leslie, what do you got for us?
I don't really have a lot to report other than I'm just thinking that maybe possibly that what we're seeing with workforce and some of the struggles that we're really seeing the impact of undervaluing human services for as long as, in budgets. And I think Fairfax County does a great job of putting extra funds in, but even with that, I think that we're seeing that, and I hopefully we'll figure out how to adjust that. And I hope that the governor's budget that he's putting forth money, but I really hope that he's also thinking about the workforce part, because like you said, if you don't have a person, I don't care how much money you have a new program, you don't have a new program. So yeah, it's very concerning.
I think it's a great point about human services. I think it's public and private. I mean, I have parents in an assisted living facility that relies on nurses and caregivers, and it's almost you have to recalibrate and say, okay, I know I'm paying money, or they're paying money to be there, but they're in the same boat. If I don't have somebody that can do X, Y, or Z, I'm doubling up shifts, and so I think it's hitting everybody. Human services being hit hard, probably the traditional undervalued, underpaid. But we see it in public and private sectors. Yeah, I'm hoping, we said at the beginning, about a year ago, we said we probably not going to be out of this for 2 or 3 more years. So hopefully we got 1 year down and we just keep putting our nose down and keep working on what we can work on. So.
Talked to several private agencies that are saying they cannot take children because they don't have the staff to care for them if they did. And that's what I get very concerned.
That's what I was alluding to earlier. I'm working on some of the early childhood stuff and in the groups that were not able to make it through the pandemic because they lost revenue and had to shut down. And it's going to take time to build that stuff back up.
It is.
All right. Well, public comment. Janet, do we have anybody for public comment?
Chris, we haven't had anybody request to provide public comment, but we do have a guest with us today. We have a citizen from Fairfax City, Miss Renner, who has been nominated to serve as a parent representative to the State Executive Council. And she has attended our meeting today. So I would just like to welcome her and recognize her. I don't know if she feels comfortable speaking, but I just want to thank her for her participation. And we have reached out. I think Leslie Abashian and I may reach out to her and meet with her since she is a Fairfax City resident.
Thank you guys for having me here. But I just want to say so you guys know the governor and the state is actually discussing and talking about staffing, industry-wide recruitment, how to incentivize the industry as a whole so students actually, think health and human services as a major, as a profession, as a degree. So we're actually talking about that at the state level and what we could do at the state level and maybe working with some of the universities and some of the programs to incentivize it. I don't know the best way of saying it, but we are thinking about it. So it's great to see that that's something that you guys are concerned. Your CMPT representative to the State Board of Children's Services actually was discussing it at the last meeting as well. So keep it up. We're listening.
Good, good, and welcome aboard. It's good to see you. The state's been fairly responsive when we've asked if there was some, we've had issues where we've had specialists come in from out of state that are licensed from other states that come into Virginia, and maybe they don't fit exactly within the Virginia state licensing, but giving us some maximum flexibility there so we can make use of folks that are relocating into our area, that they don't have to go through a bunch of hoops to get them working. So I think the good news is, the first thing about this is just, I'm not saying anything that all of you don't know, but first thing about addressing an issue is identifying it and amplifying it. And I feel like there's not a soul that works in state, local, or federal government that doesn't understand the workforce crisis that we're under. So that tends to help with some movement towards this. So thank you for whatever you can do at the state level, and certainly whatever support we can provide to help with that work, just let us know. All right. Anybody else? All right. Well, I wish it looks beautiful outside, but I'm sure it's like 45 degrees, but it still looks nice. So I hope you guys have a fantastic rest of the Friday and a wonderful, wonderful weekend. Thank you. Thanks for your time.
Thank you.
Thank you, everybody.
Thank you.